Hello everyone, I am Dr. Satyasri, Consultant Obstetrician and Gynaecologist, Ankura Hospitals, LB Nagar. Today we are here to talk about HPV vaccination. What is HPV? HPV stands for Human Papillomavirus. It's the most commonly spread sexually transmitted infection all over the world. How does it spread? It might spread from one partner to another through close skin to skin contact, vaginal, oral and anal route. It is responsible for many infections and maximum number of cancers all over the world. We all might have HPV virus in our body, but it usually stays for 1 to 2 years and later goes off from the body. But in whom it persists, it may lead to infections, genital warts and cancers. India shares 21% of global cervical cancer burden alone. It is responsible for many other cancers like vaginal cancer, vulval cancer, penile cancer, oropharyngeal cancer and anorectal cancers. So HPV is responsible for 90% of cervical cancer, 91% of anal cancers, whereas vaginal and vulval cancers around 65 to 75% and penile cancers around 65%. Oropharyngeal cancers, about 69% of oropharyngeal cancers are due to HPV virus. Now how do I know? Do I have HPV virus or not? There are no approved lab tests to know whether HPV virus is there in any part of the body or not. But whereas in the world, now we subject all the women to regular pap smears and cervical screening, and along with that we do HPV DNA screening. Through this method, we can know whether you are prone to HPV infections or later on in that regard any HPV related cancers. So now from this, HPV vaccine is a recombinant vaccine which is prepared from virus-like particles. It is totally non-infectious and safe for all the people. We usually give this vaccine in 2 or 3 doses. And what is the vaccination schedule? All the boys and girls from 11 years to 26 years can take HPV vaccine. 11 to 15 years children, we usually give the vaccine in 2 doses. And from 15 years to 26, the recommended dosage regime is 3 doses. 11 to 15 years, the 2-dose schedule is first dose now and the second dose within the next 6 to 12 months. Whereas in the 3-dose regimen, we usually give in the 0 dose and within 1 month and within the next 6 months. This is the dosage regime for HPV vaccination. For children who are immunocompromised, for both girls and boys, we usually start the HPV vaccine at an earlier age, that is from age 9 and above. From age 9 and above, we give a complete 3-dose vaccine schedule. The main aim of giving this vaccine is to protect the child or the person from the HPV virus before they get exposed to the virus. The main route of exposure is by sexual contact. So before they get exposed sexually, we need to give the vaccine. So that is the reason we start the vaccination from 11 years of age. So for person more than 26 years, they are supposed to consult their clinician and discuss the risks and benefits of receiving the HPV vaccine. How efficient is the vaccination schedule if they take it after 26 years. In case of pregnancy, if we usually advise the pregnant women to complete their HPV vaccination schedule well before they become pregnant. Once they are in the vaccination series and then they get pregnant, how do we counsel them? If at all they have completed the vaccine and immediately they got pregnant, nothing has to be alarmed. And if they have taken the first dose, the next 2 doses can be postponed until later delivery. If they have conceived during this vaccination series after the first dose or the second dose, we need not worry whether this might affect the baby or not. This is totally safe during the pregnancy, but we do not recommend this vaccination to protect the baby or the mother during the pregnancy. There are 3 types of HPV vaccines: a 2-strain vaccine, a 4-strain vaccine and a 9-strain vaccine. The most commonly seen strains are 16 and 18. So Cervarix, which is most commonly available, is usually promoted with 2 strains, whereas Gardasil 4 and Gardasil 9 we have with 4 strains and 9 strains respectively. Worldwide, we give HPV vaccination with 4 strain vaccine. What are the side effects of this vaccination? Usually a small reaction at the injection site is seen like with any other injection. Otherwise, there are no serious deleterious effects of this vaccination injection. We usually advise the adolescent girls or boys to lie down or to remain seated in whatever position they are for a minimum of 15 minutes after they receive the vaccination, because there are few cases that who have had a syncope after the vaccination. So if at all you have a family history of a cervical cancer or a penile cancer, anorectal cancer or oropharyngeal cancer, we usually advise them to take the vaccine whenever they got to know that one of their family members is affected. There is a significant research material available that this HPV vaccination has brought almost 80 to 82% reduction in the HPV infections and the genital warts among the young women way back when it is started from 2006. We advise all the school institutions, and in this regard we bring this thought to all the school institutions to initiate the HPV vaccination as a school program, so that all the girls and boys before going out from the school, that is around 15 to 16 years, they get vaccinated and get protected themselves from the HPV infections and a future cancer. HPV vaccination and a regular cervical screening along with high risk HPV DNA screening will help many young girls and women prevent themselves from most dreadful cancers in their later life. So plan accordingly for your HPV vaccination and the cervical screening.